Well, I'm Rachel Nash, and I'm really excited today. We're going to have a truly amazing conversation with Marty and Rachel Haynes, and they run a great business called HFC Insurance, and they're the good ones.
You need someone to handle your insurance like you have an accountant, you have a lawyer. You need that person.
I think sometimes as agents, they think that it's quick and easy just to put somebody on a Med Advantage plan because it's $0, and sometimes they haven't had someone to look at their doctors and their prescriptions, which can really make a difference.
You gotta watch those commercials. You know, that small print that down there that you can't read is there for a reason. And then when that person's talking 400 miles an hour, there's a reason for that. Stop it. If you've got, we've got TV now, you can stop it and go up there and put your face to the TV like I do and read that stuff.
Well, I'm Rachel Nash, and I'm really excited today. We're going to have a truly amazing conversation with Marty and Rachel Haynes, and they run a great business called HFC Insurance. And what's amazing about them is they know the insurance world. And they're the good ones.
Yes.
They are, yes, the good ones, and really help people, not only help people, but help their community and understand healthcare, understand insurance, and are true advocates. So I would like, if you could, and again, thank you on behalf of mypatientadvocate.us, if you could tell me a little bit about yourself, Rachel.
Absolutely. Thank you for having us, and we do find it a thrill to be here to be able to share and get information out. So I guess I should start with my journey of where I've actually been and where I'm at now, because it definitely plays one thing into another. When I graduated college, I went to work at Medical College of Georgia as a financial counselor on the ambulatory pediatric ward, which was for oncology, hematology, and allergies. So it was my responsibility to get those parents support that they needed financially, mentally, and whatever resources as those children were taking those treatments or getting their care. So that started the ball rolling with me really having a passion for helping other people. It was a very taxing journey, especially when you hit a wall, like there's nothing that you just come to a point where you just can't find something to fit them in with, but it was very rewarding. Upon that, whenever Marty graduated, I had moved back to Charlotte, and I was actually working at Presbyterian Hospital as a counselor. And after that, then I went to work for a medical practice in Lancaster, a surgical office, and really enjoyed that as well. Got to learn and understand the whole CPT, ICD-9,
Wow,
all that coding, just how all of that makes such an impact for billing and just the whole working of all those integral little areas.
Rachel, I love that. I love the fact that you had this whole other realm and so much experience that you're bringing into the world you're in now, because those are the issues that people are having. So we all, insurance is very important, but you understand not just insurance, but you understand all of those nuts and bolts. So that's amazing. And I love your name, Rachel, because I'm Rachel too.
Isn't it a great name?
Yes. So,
but when you're talking about those nuts and bolts, you are correct. Like I said, the CPT-9 or ICD-9, the CPT coding, all of that really does make a huge difference. And having that understanding not only of what your plan will pay for, but how it can be manipulated to get better coverage or to make the most of what you have. Now, beyond medical practice experience, when I had Kayla, I decided to stay home for a little while, and after that I decided I wanted to re-enter the workforce, and I decided to go in education. I knew that I always wanted to teach and wanted to help others, so I decided to go through that journey, and for 16 years I taught middle and high school business ed classes and such to children, or should I say young adults, and that was a joy. Just being able to cultivate, and all they taught me, I think they taught me more than I probably taught them, but it certainly has been very helpful in the present position that I have now as a client manager with our agency. It certainly has, I guess you'd say, it is the well-baked cake. All of those ingredients have come together, and it is just a well-baked cake. And I think that's what makes me different than probably some other agents or some other entities out there. I have had some various experiences, but they've all tied back in to being the focus on the client or the person, and using all of those resources, those skills, those tools that I've had a chance to actually utilize and research and cultivate, I really think makes a big difference with what I can provide for our clients versus what someone else can provide. Mainly looking at what those needs are. You, as a teacher, I learned to read the body language. I learned to read the student, not only physically but mentally. And our clients need somebody that will help them read, because it's overwhelming. They're frustrated. They don't want to have to deal with it. It's just a very daunting task for them. So I do think being able to bring all that I do to the table, I certainly hope, I always tell them, I'm going to try not to overwhelm you. I'm going to educate you, and I'm going to empower you with all the information that you need, but I don't want to overwhelm you. So
that experience that you bring does make you different. It does. And I will say too that, what I'm hearing, you're a patient advocate. You are a patient advocate. And
in my soul, yes.
Yes, you really are.
I am.
You really are.
I try.
Yeah. And I feel, hearing this about you, it just makes me want to, going forward, make sure that everybody I know is coming to you and Marty.
Well, I appreciate
Really.
that. That's a huge compliment.
Really. Really. And Marty, can you tell me a little bit about yourself?
Yes. Well, yeah, born and raised in Lancaster.
Okay.
Brief time I left Lancaster. I wasn't coming back. You know how that usually happens when a kid leaves. I'm going somewhere and I ain't coming back to this small town. Well, I wound up back. Went to the Air Force first, served there, came back and to Lancaster. The intent was to go to Clemson until I met Rachel at JCPenney. And that's another whole story, and you'll go, oh, that's so sweet. But ultimately, I wound up at USC Aiken because that's where Rachel wound up. And we were married a year later. I had to stay on campus with a bunch of 18-year-old boys who just left mama. And you can just imagine that. So we wound up graduating there, moved back here. And that's where I got my first job after college, was working with Cigna Healthcare. So I had a background. I wanted to go in that area or hospital administration, wound up on the insurance side. And that's when I learned a lot, because I dealt with small businesses. That's kind of where I've always focused, and depending on what that definition is of small business, that's where. And ultimately, Cigna closed those offices, and I lost my job at that point and wanted to do this. I always wanted to have my own agency. And here's an opportunity. I got to go home, and this was when Rachel was staying home with Kayla. I got to say, hey, I don't have a job. So, so that's kind of what started all of this in January of 2003. started the agency, and that's kind of how we've come on. It initially was just employee benefits because that's what I did there. Over the years, we've migrated into Medicare and individual health insurance, home auto. We've kind of migrated out. And as time was going on and I was growing, I said something to Rachel one day, and I really didn't expect the answer I got. And I said, hey, would you like to come on and start working at the agency? Because I knew the background she had. I knew her. Of course, she's my wife. I knew her, and I was like, this will be a great opportunity. Right. And it just was. And it's, how many years? I can't even remember.
2019 is when I came to work for him.
So 2019, it's been a great fit. Somebody says, how do y'all work together? Well, I'm at the front. She's on down the hall.
Yes.
And, but, we were, we've been married 32 years. I got that right. So, we were meant to be. And so it's worked well. It's been like a hand in a glove. There's 6 of us total. And so it's kind of how we got to where we are now. And it's been a great fit.
So working with systems like Medicare and ACA, and how do you stay motivated when it comes to all of the pieces? And it can be, it's very confusing for most of us.
It is a daunting task, let me just say, to keep up with everything that's going on at current time. And you're also looking at what's going to be coming down the pike further down the road.
Okay.
So you're kind of looking at 2 angles at all times. I think the biggest thing that helps me stay focused is just watching out for those webinars, just trying to get as much education as I possibly can to put in my toolbox, so that way I'm aware of what's coming up, or aware of what changes may be on the forefront. If I didn't do that, I would be floundering.
And it's kind of, we know that what people don't know. And my big thing, and my aspect of is one of my roles is also in the marketing aspect. So I have to look, and I try and look at this as a consumer, because one day I'll be a consumer of that product. And you see these commercials on TV all the time, and it's talking about Medicare. It entices people to, hey, call this number, and people don't know what they don't know. And I always tell people, and our big thing is, whatever, you don't have to use us, but find someone local you can trust. You can walk in the door and help you, because you need someone to handle your insurance like you have an accountant, you have a lawyer. You need that person, because when they call these 800 numbers, they have no idea what they're getting. Mm-hmm. And when it comes to Medicare Advantage plans, they see these 0 premiums, and they don't understand when you go into the hospital, depending on the plan you may have a $9,000 out-of-pocket max, and they go, I didn't realize this. Well, they get online or they go call these 800 numbers, and they do something that they're not trained or educated enough, and they just don't know what they've got. And we experience that a lot when we bring on clients, and they're like, I didn't know this is how it operated. So the fun part of what we get to do, whether it's Medicare, whether it's employee benefits that we're doing, the fun part is we just love to educate. Say, look, here is how it works. Mm-hmm. This may not be what's going to work for you. Go back to Medicare. Our first thing is, it's just where we've looked at it. Is Medicare, original Medicare supplement, and a Part D. Okay, if you can afford the monthly premium, that is the best way to. We say, look, this may be the best way for you, or it may not be. You may be like in the network, small network. This is where you're going to go. You always go there. It might be a 0 premium for you, but you must understand how it's going to work. And if that fits you, we're just going to give you the information. We're going to guide you and let you make that decision. What is best for you? What's best for you might not be what's best for that next person. So that's kind of how we go about it.
What is the reason that, I've noticed you're very different in the fact that you recommend the supplemental, mm-hmm. Yes. Because of your backgrounds, which I think is great. And that's been a learning curve with me, with understanding the Advantage plans. But it seems like most insurance agents, they push the Advantage plans. Can you kind of talk about that a little bit?
I feel like sometimes agents push the Med Advantage plans because it's clean and it's easy, in maybe in their eyes. But if you're really looking at all the parts, if you're looking at their providers, if you're looking at their prescriptions, if you're looking at whatever their need may be, if you're not careful when looking at those plans, you may not be able to have your full extensive journey of recovery.
Okay.
And what I mean by that is my dad, I use when I'm explaining things to my clients, I always tell them that, my parents are divorced. My mom has a Med Sup and my dad has the Med Advantage. So I get to see the personal journey on each. The Medicare supplement, sometimes people, they don't necessarily like the fact that you have a monthly premium. And I think there again, that's where they jump to the Med Advantage plan. They're looking at the zero premium a month dollar. Look, you're not having to pay anything up front. But as we know, it's either pay now or pay later. You will pay. And the biggest difference between that Med Sup and that MAPD or Medicare Part C is networks. Bottom line, networks. If you have Med Sup, you have freedom and flexibility. If you have Med Advantage, you are held to a network. Although they will give you out of network benefits, but then you have that higher out of pocket that you have to meet. So I think sometimes as agents, they think that it's quick and easy just to put somebody on a Med Advantage plan because it's $0, and maybe it's been my experience with some of our clients. Sometimes they haven't had someone to look at their doctors and their prescriptions, which can really make a difference.
Right.
Where you can get your care, how you can get your care. So I would like to think it's just the fact that they maybe are not as well breasted in the information themselves, or maybe they were taught or led by someone else. But I think that gives us the unique advantage that I speak for myself. I have one parent that's on one and one parent's on the other, and I can bring that true experience and talk about the positives and the negatives of both aspects. So
that is really important because it's really a testimonial of both together. And Marty, talk a little bit about commercials and what people see right before open enrollment.
Oh, yeah.
Can you tell me about the danger of that and what happens?
Yeah, well, she touched on a piece here is, you may call this 800 number. One, you don't know who you're talking to. And if you need to call them back, you're not going to get the same person. You may call 10 different times, get 10 different answers by 10 different people. So that's one thing. Another thing is when we sit down and go through all your medications, are they doing that when you're on the phone? What are they doing? What that person is doing, we don't know. And they may be saying, hey, I need to put X amount of people on this Med Advantage plan because I'm getting X, and that's what they may be pushing. So I'm not saying that the Med Advantage plan. We're going with what's best for you and what you're comfortable doing. If you can't afford a Med Sup premium every month, you're saying, hey, I can't afford it. Okay, well, this is the road you're going to go. Now let's make sure you've got what you need. There was one commercial on TV, and I don't want to give too much credit, but they'd say, call Martha. And there Martha sitting there with her big glasses on and everything, and she's all frustrated. And people would call, and my marketing aspect was don't call Martha, call Marty. And we would try to get out there to say, hey, here's the difference in it, because you don't want to make a mistake.
No.
And choose the wrong plan. So even when we're looking at Med Advantage plans, we're having to look at the market, what's available, what's going to best serve that client. And that client understand, okay, you have a zero premium, but you must understand you have a $9,000 out of pocket. And if you wind up in a hospital, and you got a $100,000 bill, $200,000 bill, whatever it may be, your out of pocket is up to $9,000. Be prepared for that bill when it comes. And sometimes they're just not educated. They don't know that that's happening. So you got to watch those commercials. That small print that down there that you can't read is there for a reason. And then when that person's talking 400 miles an hour, there's a reason for that. Stop it. If you've got, we've got TV now, you can stop it and go up there and put your face to the TV like I do and read that stuff.
Very
You'll
important.
Be surprised.
Yeah, very important. Same thing I noticed with pharmaceuticals.
Oh, yes.
It's
Yeah.
just drugs,
Watch it.
more drugs, more drugs, and those are the only commercials I think I see anymore.
Well, that is. I mean, they want to get that name recognition out there. So when you go to the doctor, you ask for that. I saw the commercial for so-and-so and I want that.
Then they don't understand the price when it winds up going to the pharmacy, what that cost is going to be for that medication. So there's a lot of education, like with anything.
So I know you both are from Lancaster, and community is very important. I love that about you. Do you serve South Carolina and North Carolina, or where is that? Do you serve everybody? How does that work with insurance?
We're pretty seamless for South Carolina and North Carolina.
Okay.
I do have a license for both.
Okay.
And don't really venture out to any other state because just having those two. That's a lot to keep up with, working of the ins and outs of everything. But yes, North Carolina, South Carolina, we can certainly take care of you. And I do have some clients that have moved to another state, and yet they would email me and ask, hey, I'm moving, let's say to Idaho, and I've noticed that these are going to be my options when I get there for this Med Advantage plan. What do you suggest? I will help guide them through, the providers, the prescriptions. I'll still have them guide through that. Can I make that jump for them, or can I make that transition for them? I really can't, but I'm more than happy to try to help them, especially when they've been my client. And I take ownership, and I think of them not as clients, but as family members. So
Advocate.
That's
You
right.
are the best. You are great. So, Marty, guiding someone with Medicare and ACA is no small task. It isn't.
Right.
When was the first time that you realized that your guidance made a huge difference and that it was absolutely necessary?
Right. It actually goes before Medicare and ACA.
Okay.
When I worked at Cigna is when it first came out, the managed care product. Okay. Before that, you had a deductible and 80/20 on an health insurance policy. It is what it is. When it came out that, we got these copays now. You can go to your doctor for $5. You can get a medication for $5. And the interesting part of all of that is our underwriters will tell you about 2 years into that, you've got enough data. You watch the utilization of healthcare go from here to way up here. And what happened is people, all they saw was $5. They didn't see what the actual cost of care was.
Okay.
And they still don't today. They still don't have an idea of cost of care unless they go to get these medications and go to the pharmacy and they start seeing, especially if some of the medications for weight loss that are not covered, and they're going, okay, I got to pay $1,000, I got to pay $2,000 for this medication. That's when they see it. So that's where I first saw that process, and they've done the same thing to Med Advantage. They've made it an HMO managed care type plan, and paying carriers to manage your care for you is what they've done. So it's the ACA to an extent, again, is the government, whether you like it or not, the government getting involved in healthcare.
Okay.
So anytime you see that, when you see regulations, you see where you've got to cover this, you've got to do this, you watch premiums start going up. It's like when you go buy a car. If you want all the fancy gadgets, what happens to the car, price of the car? It goes up. Well, healthcare has been the same thing, and we're over treating people because they're afraid of getting sued. Doctors are afraid of getting sued. So you're having all these extra tests, and it runs up costs for everybody. So, the Med Advantage and the ACA, we already had some idea what their thinking process was, and that's what it is today. It's more the ACA is more of a, even though depending on the carrier you use, may have an out of network option or a PPO network. They're still are trying to direct all these things to a centralized location and manage that care. So it's still a challenge.
Right.
Regardless.
Right. One question I just don't understand, and this is South Carolina. So if somebody makes $0, they're told that they need to apply for Medicaid. They get turned down with Medicaid.
Right.
Yet they still can't get, am I correct?
No.
They still can't get health insurance.
No.
And what is the way around that, and why do you think that is? I know that's a big question. But
it is.
I want to. That one just blows my mind.
They fall in.
Yes.
They fall in the hole. They're in a no man's land per se, because when they did the ACA, they set the minimum income.
Yes.
They say, well, if they don't make the minimum, then they're gonna have to go to Medicaid. Well, if for some reason they're not qualifying for Medicaid, you've got a certain portion of the population that doesn't have Medicaid, nor does it have individual health insurance. So that is a problem, because occasionally we have somebody come in for an ACA
Yes.
plan, and okay, well, how, are you working? No. So that's what we run into.
It's very frustrating, and it's very heartbreaking
It
that
is.
there is nothing in place to bridge that gap. And I think that's something that I hope, maybe with administrative movements and things, I really would like to see something evolve for that sector of folks. And sometimes it may be that they are working, and not everybody makes $100,000 a year.
Right.
They may be working full time, and unfortunately, their pay is just low, and they just don't qualify. They too much for Medicaid, not enough for Marketplace, and then they're just caught. And that's where things like CareNet, that used to be in Lancaster, of which now it's Plexus, comes in to help. Thank goodness we've got some of that in place, but even with that, that doesn't take care of everything. There's a disparity there that is just unspoken, and it seems like it's turned a blind eye to at most expenses, and that's just very frustrating that we have all that we have in this country, all of our different resources and everything that we have, but yet we still have a sector of those folks that you can't put with something, or you can't get them help because they fall in that gap.
Yep.
What was it like before ACA, by chance? What was it like? Was it different before we had the Affordable Care Act for these individuals?
Well, you had another problem. When you had, before the ACA, one good thing I will tell you out of the ACA is it's guaranteed issue.
Yes.
Okay? It's guaranteed issue. It doesn't matter. You can need a heart transplant, you can come on the plan and get the heart transplant. Okay?
That's good.
That's a good thing. Prior to that, if we wrote you an individual health insurance policy, you had to go through medical underwriting. And that would always frustrate me. I'm like, this is why these people need insurance, because they have issues. They always wanted the healthy. And I get it. On a risk side, I understand that. But people couldn't get insurance. Well, now they can. Okay? Now, the bad side of that is everybody's in a pot. They're not asking health questions. And the risk, people will use it more. So premiums go up. You got funding from the government. So anytime the government funds anything, it always goes up. Look at colleges. I mean, all of that stuff goes up anyway.
Right.
So that's how it was before. You just, if you either couldn't get it, hopefully it fell back on you working someplace where you had an employer option to provide that coverage for you. If you didn't, if you was uninsurable, you fell back on either try to get some Medicaid or try to get some funding from somewhere else.
So with mypatientadvocate.us, it's a new business. It's different than the one I have, Nash Patient Advocacy. So it's nationwide. So what can someone do to find a Marty and Rachel if they're not in North Carolina or South Carolina, or if they're in North Carolina and South Carolina? How do they, I guess the question that I'm asking is, what questions do they need to ask their agents to make sure that they find, they're not going to find you all. I mean, you guys are here, amazing, but someone that cares, someone that's community driven, and that has the background to give, because people, this is so confusing. It's like speaking you guys speak another language. You realize that, right?
It definitely is.
You speak insurance, you speak Medicare. Most of us don't. So what can they do to make sure they don't end up doing the wrong thing and with the wrong, I like local businesses. That's one. But,
Right.
Can you talk about that a little bit?
I think the most important thing is you need to have an understanding of what coverage you're looking for. Once you get that clarified, and I know that may sound silly to say, but I mean you gotta know what you're shopping for. Just like when we go out shopping, you just don't hit the store, or I don't. I hit the store with an agenda. I don't go without an agenda. You need to know what your idea of coverage for you is going to look like. And when you're trying to find somebody, I do say try to go local. One, because you have immediate access. If you call and leave me a voice message and I give you a call right back and you still don't understand, I might tell you, hey, can you come on over to the office and let's just sit down? Because face to face, you can get a lot more accomplished face to face instead of through email and through phone. You can't read somebody's body language. You can't understand whether they're really following everything that you're telling them or that they understand it. But if you have that personal interaction with them, in my opinion, that just makes a huge difference. And even using Zoom, we during COVID and all, we used Zoom call meetings, and that was very helpful so that even though we couldn't be there with somebody due to the restrictions, we were there. We were there, still there.
That's good.
And present. So
And to add on that, don't call 800 number, regardless. So don't call 800 number. The next thing is you need to ask around your friends, others, because people are going to tell you if they thought their agent was helpful, was knowledgeable. People will tell you all day long. Look at reviews, and when you look at reviews on someone's website, look at what they're saying in the review. I didn't understand Medicare. They helped me understand it. They guided me. They told me things I didn't know. Watch for those things and look for them. On our website, we offer like a Medicare checklist or a new to Medicare. We offer some of those things and put it in plain English. Is who you're looking for? Are they educating you, or you don't feel like they're just trying to sell you something?
Okay.
We tell our office all the time, look, don't, if you can't help them, if we can't provide anything any better, let them keep what they've got. Don't try to sell them something just because, whatever. People walk in the office, regardless whether it's Medicare or home or car. If you walk in my office and say, look, Marty, I want some cheap car insurance. The first thing I will tell you is, I don't provide you cheap insurance. And they look at you funny. And I say, look, I'm going to provide you the best coverage for the best price. Because if you have a car accident, you want to make sure it's going to take care of you. That's what insurance is there. It's there to protect you, whether it's your car or whether it's your Medicare. When you use it, you're going to want to make sure I understand it and it's what I need. Again, your needs are going to be different than my needs. So you got to make sure of that. So do the research. Listen to what other people are saying. watch the online reviews, and you'll get a good idea. And then, hey, just go in, make an appointment, sit down and talk to somebody. Say, hey, I want to interview you.
That's great.
You know, if somebody walked in and say, hey, I'm looking for a new independent insurance agent. I know y'all do all these things. Can I interview you? Interview them. Hey, it'd be great you come sit down in our office, and I'll talk to you, as you know, I'll talk to you all day. We can have a conversation, and I'll let you know, what we do. We actually call what we do, we branded it. Two aspects of it. For individual side, it's called our client concierge service. If you go to our website, hscinsurance.com, it's on there. Client concierge service. On the benefit in the group employer side, it's called the employee concierge service. We don't want anybody calling an 800 number. That's why it's not just, you looking for something, you call and that's where you go. The whole idea is I want our clients calling us. When they have a question, you call us. Don't call that 800 number, because you don't know where it's going. You don't know who you're talking to. And that is a service we hone in. We provide, like I tell our group clients, if you're local enough and your spouse doesn't understand something, I want your spouse to be able to get in the car, drive to our office, sit down and say, can you explain this to us? That's important. If they don't have a client concierge service, walk away.
Yeah.
That's key.
That's great. So, Rachel, if you could talk to policymakers for 1 hour based on because you have extensive experience, and I love the fact that you have different experiences that kind of made you so good at what you do. What would you tell, and I'm going to ask Marty too, because I want to hear both of you, what would you tell the policymakers? 1 hour. What needs to be changed?
That's a loaded question. I think personally, looking at all of the clients that I've served, whether it's Marketplace, Medicare, Supplement, Med Advantage, we need to make sure that people are just taken care of, period. We need to take care of people. I would really, and I don't understand why there's not things in place now, like we were talking earlier about those that fall between the gap. I don't understand, in the society that we are in, as robust as we are, why we do not have things in place to take care of those. So for me, that policy needs to be focused on taking care of our folks. And for our Medicare clients, I know whenever I speak with them and whenever I talk with them, their greatest concern is, am I going to have to choose food or am I going to have to choose medicine? I mean, we should be doing more, or there should be more allotted for that particular sector as well. I mean, they've paid their dues. They've done they've worked. They've been there and done that. Let's take care of them. And there's just got to be some change. There's got to be something that they can do to rectify that. And it may not be perfect, but there's got to be something.
It's better, right?
It's better than what we're doing right now. So to say something specifically, I'd really have to just look at a new bill or a new suggestion that was being, brought to the table. But I would, bottom line, I want to make sure that people are taken care of. I need to make sure that they are having those needs met.
Yeah.
Period. Just meet those needs.
Spoken like an advocate.
All right. I got two.
Okay.
One is get rid of prescription commercials, number one.
Yeah.
And the other one is revamp some of the laws. And what I'll touch on those very briefly. We took commercials off for cigarettes because of the impact it was having on kids and everybody else. See a commercial, it affects people. The other thing is we saw and we know when prescription were allowed to be medications commercials, we saw utilization and we saw prices go up.
Mm.
I shouldn't be able to go into my doctor. My opinion is my opinion. Shouldn't be able to go into my doctor's office and say, "Hey, I want that medication. I saw this celebrity said to take, and I want to take it today." And I'm sure doctors, it's a frustration for them too, because people seem to think I saw it on a commercial. Now I'm educated. I went and I Googled it, and now I'm smart and I got all the answers. Well, that's one thing I think they need to back up, revamp that. And the other thing is, when it comes to care, people are scared. Doctors, I can understand it. If I misdiagnose, I miss something. Well, I'm gonna have 42 tests to do this, not because I think it's right, and I think we need to find this thing. I'm covering my tail. You go to the ER, they're gonna cover their tail. So we've got to figure out what's the right balance of, yes, I want doctors and hospitals and physicians wherever they are to be accountable. I do, but at what point? That's the same thing as if you ever go to Florida, you see all these billboards with all these lawyers. They are so happy in Florida about everything. Well, what happens to your insurance premiums is the insurance premiums are continuing to go up because everybody is so happy. So those are two things I think if they can bring in line a little bit, you will see an effect. I know the state of South Carolina is doing on liquor liability. That's totally different here.
Right.
But they're addressing those things because you can't get certain insurance because the liability is so high. So they need to touch on those two things. Those are ones I'm stuck on.
So looking back, big or small, why do you feel this work is so important?
I'm passionate about what I do because I want someone to be taken care of. I want them to know what's available to them, and I want them to know the pros and the cons, and I want them to understand it. And not many folks out there are going to take the time to go over the whole picture. They're going to pick pieces of it, but I try to paint and give information for the whole picture, not just the parts.
Yeah, I like the education piece. And I'll give you an example because we do all sorts of things. One lady reached out to me and said, I got my car insurance online. And I say, yeah, do you know what you got? She said, yeah, I got the same that I had before. And I said, do you really know what you got? Because she saved a little bit of money a month.
Right.
And I'll just tell you how all this works, whether it's your health care, you're doing health insurance quote, or you're doing your car insurance quote online. What happens is carriers know this. Like you shopping on Amazon, you go in there and you're looking at price. Well, when you go shop your insurance, you're unchecking this, you're unchecking this because they know you're looking at this total that's at the bottom. Okay? So if you have a claim, all the carrier says, look, we're paying according to the contract that you selected.
Wow.
So they're like, well, then why did I select that? I don't know. People think, they go online and Google something. They're now insurance agents. They've got license. They do continuing ed. They understand. They don't. But they buy their insurance online. So that's why we like that. I like that when I run into that, I like to educate. They go pull your old policy. I bet you got the state minimums. State minimums in South Carolina on insurance, car insurance is $25,000, $50,000, $25,000. So what that basically means is if you hit a truck and it's $75,000 and you totaled that truck and you got a $25,000 policy, your insurance carrier is going to say, hey, we're just obligated to pay $25,000. You totaled a $75,000 truck. Somebody's coming for that $50,000 that you just did, and they bought that insurance online because they didn't know any different. Well, again, you need a lawyer, you need an accountant, you need a pastor, you need an insurance person.
You do.
To sit down with, and whether it's, again, Medicare, health insurance, whatever it may be, to say, here's what you need. What is your risk? What can you lose? Now, somebody says, look, I don't have nothing to lose. Well, then, you do whatever you need to do. But if you've got a house or you've got things and you want to make sure you are secure, you need to make sure your insurance policies, one way or the other, are right.
So understanding insurance, as I said, is no easy task. And you're dealing with people's really lives, right?
Yes.
So And there's so much compassion between the two of you. It's amazing. I'm just, as I said, you're my new people. When I get my new insurance, I'm coming to you, I'm sending people to you. But what do you do to recharge? Talk a little bit about when you're not working.
We're about to go on vacation.
Oh,
We're
good.
about to,
Okay, so you do recharge, right?
Yes.
We do.
Okay.
And I will say it's more important for me for Marty to recharge while we're on vacation than me. I'm a wife, I'm a coworker, and I'm a mom. I can kind of sector those things out for the most part. But speaking for Marty, he needs that unplug. He needs that time when we're out of the office. He doesn't need any emails. He does not need any phone calls. He needs to be just left alone. Let him read, let him rest, and just let him be. That is the best therapy that he can get. Now, on a day-to-day basis, we work together, yes, and we both have things that go on during the day, but when we get home at night, we do not talk work.
Oh, good.
It's not allowed, unless it's an emergency, of course, but for the most part, there is no work stuff that's brought home. So that way we have that unplugged time. And we do believe in making time for our family. We do try to go to dinner together and do things together, and you make time for what's important.
It's funny kind of think of when she came on, because I have a problem not sometimes unplugging. I just want to keep just focusing on it and what can those aspects of business. Well, she came. She says, "We're going somewhere every quarter.
Yes.
Every quarter we are going somewhere." So she made sure that something's there. Whether it's a long weekend at the beach, whether we're going with my brother we're heading to the mountains here over the summer, whether we go to St. Pete, Florida, wherever we're going somewhere. Because that's the difficult part in me.
Okay.
Is how can I make my visibility better? How can we make what we do inside better? Because I'm always, all right, how can we do this better? So that separation time, she makes sure I get it. And we don't talk shop at home.
Mm-mm.
We leave the office. I'll leave the office, go to the Y. That's how I get my out of me, and then, we at home, we're at home. Then we get up, we go at it again. So that's important.
I could talk to you forever. I just want to ask you another question, then I have a list of fun questions.
Okay.
But if you could tell me, you're both from Lancaster. Did you know each other growing up?
Nope.
Wow, it's such a small, isn't it
Yep.
a very small?
Is that not wild?
That is.
Yep.
People that he graduated with, it's like, oh, I knew them, or
Yeah.
I heard of them. I'd never heard of
Now,
them.
the funny
before.
side of this story that I did not get into, one is her mother worked with my daddy. They knew each other because they worked for Springs in town. What happened was my mom went into JCPenney when I was in the car with my mom shopping, and she said, "You need to go in and see this sweet little girl I met inside." And I'm like, any guy's going to go, and your mom's kind of directing it. That's okay. Well, a week later, I went in, didn't see her. Another week later, I went in. I'm heading out the door, and I'm walking by. If anybody remembers the old JCPenney in Lancaster, I go by the jewelry counter, and all the sun was coming in that glass, so I really didn't see anybody. And I heard this, "Sir, did you find what you're looking for?" And I turned and I looked at her, and I'm 6'4", she's 5'2", and I looked down and I went, "Well, yes, I have." And we got to talking. I got to put my name on a card, and I pushed it to her. I said, "Give me a coffee. I'll go get lunch at the Pizza Inn in town." And she pushed it back. And she says, "I don't call guys, they call me." I was like, oh, she got a little spunk to her too. So we went on a lunch date, and that moved on to the earlier discussion where I wound up moving, just stopping everything. I moved to Aiken, stayed on campus with a bunch of 18-year-old boys, and a year later we were married. So we were married and going to college. So
Yes.
that all kind of, so that's that kind of story.
Love it. Love it. So we're going to do a pointing game.
Oh, okay.
Okay. So I'm going to have to put my glasses on for this. So you're going to point. If it's you or if it's you, Rachel, or if it's you, point to Marty. Marty will point to you.
Okay.
Who's more likely to start a project late at night? Okay. Oh wow, that was good.
She turns in a pumpkin after 9 p.m.
Yes.
Who's better? I think I know this, but I don't know because sometimes things surprise. Who's better at staying calm when something goes wrong?
Oh, that's funny.
Really? Okay.
It depends on what's going wrong.
Okay.
That's
It
probably true.
depends.
That's probably true.
Who?
Yeah.
Talk about that. So what?
Well, I'm going to use something that was very recent. I seem to remain very calm. This time last year, I was going through a lot of health issues. A lot of health issues. I ended up having open heart surgery in June. And the testing and everything that was leading up to that, it was just very frustrating.
Mm-hmm.
Again, understanding insurance and making sure.
Gosh.
But I would say I was probably calmer during that time
Mhm.
than I think Marty was, and
Yeah.
I could kind of feel his anxious
Yeah.
and uncertainty. And it was like, okay, I've got to stay grounded, and like, this is not a big deal. It's not a big deal until it's a big deal. And
Yeah.
so
Wow.
I think it depends on what pressure. And I think that's the good thing that I can say about our relationship is I don't think we both carry it at the same time. I think
Yeah, it takes one another saying, "Hey, calm down."
Well, that's good. That's
I
good.
think it's
Yeah.
kind of like a push and shove type
Okay.
thing. I think it's a give and take. So when you say that, I think it just depends on what's going on.
Okay.
Because even though it was my body that was acting all goofy and needed all this care, I was the one who was calm and was like, this is not a big deal. This is okay.
You got
We're
this.
just going to cross this bridge. We're going to get over it. We're going to do fine.
Okay.
And after my open heart surgery, I was only out of work.
She was out of work 17
17
days,
days.
5 of which of those 17 were in the IC unit.
Wow.
You women are tough.
We are. Yes. It must be maybe it's a Rachel thing.
That's it.
It must be a Rachel thing.
Who's more likely to lose their keys or their phone? Okay, that was good.
I have a hook on the door in the office and at home that I have to put them
Yes.
on there. And she laughs because I walk right out of the office, go get in the car, and hit the button, and it ain't starting. So I had to put a hook because I don't like stuff in my pockets, even though the key's in it right now. So that's me.
So who cries more easily at movies?
I do.
Okay.
I'm tenderhearted.
Who's the better driver? Okay.
Oh, there's a story there.
I know. What is this?
Short
I want
story.
to hear that one.
Short story.
I want to hear that
So
one.
everybody know this. She would hit so many curves that I had to zip tie. She had a Toyota Camry. I had to zip tie her hubcaps to the rim because I had to, and they're like $200 a pop. I come out and her hubcap be gone again. It just pop out and go riding down the road. I had to replace them all, and all of them, at least one. There were some I had to replace twice. So I am the better driver.
I
So there you go. Get out of the way when she's
right.
I blame Toyota. They should have put better. They should have put better
Yeah, let's blame Toyota.
Her driving.
better materials on that tire than.
Her driving.
Who's more likely to volunteer last minute? Last minute volunteer opportunity.
I'd say I will.
Probably so.
Who's more organized?
Me.
Okay. Who's the bigger softie?
Mm.
That's
Yeah.
it'd be her.
Who has the louder laugh?
I'm
Okay.
the loud mouth.
All right.
It's given.
All right. So these are questions. These are real quick and fun, and you can just answer, both of you. So it's coffee or tea,
Tea.
early morning or night owl.
Early morning.
Not out.
Oh wow. Okay. Beach or mountains?
Beach.
Oh, that's good. Sweet or savory?
Sweet.
Cats or dogs?
Cats.
Cats. Good.
Oh, you like cats too.
love
I do
cats.
too. I have
Yes.
a little Fred and Ethel.
Aw.
So, music or total silence?
Music.
What do you think, Marty?
I listen to a lot of music podcasts, but at times I just gotta be quiet. So, but mainly music.
Okay. Road trip or staycation?
Road trip.
Yeah.
Okay.
Yes.
Summer or winter?
Summer.
I like both.
Both. Comedy or drama?
Ooh, comedy.
Yeah. Oh goodness.
Okay.
She horse laughs over TikTok all the time. But go ahead.
If you could master, now it's a kind of personality and reflection fun questions. If you could master one hobby or skill instantly, what would it be?
Sign language.
Oh, okay.
I would love to have the ability to do that.
Wow.
I mean, what a great
Skill set.
other method of communication.
Yeah, yeah. Marty?
I'd like to be able to wire. If I ever had to wire your house, I'd burn it down. I don't like electricity, but that's something like that I need to know how to do. But I got shocked one time and it just fried my brain, and I don't like it.
What is your go-to comfort food?
For me, I think it's ice cream.
Probably so.
Okay. If you could have dinner, I love this question, by the way. If you could have dinner with one historical figure, who would it be?
She ain't gonna know this answer. She was tormented over something like that. Did anybody come to mind? No. See.
What about,
Really?
would a celebrity maybe?
Yeah, maybe something like that. I know this. I really like Mike Rowe. really.
I
I really
know.
like him. He's just so out of the box with thinking.
And he's
and
getting
so
it. He gets it with
forward-thinking.
trades and,
Yes.
kids come out of college today and they end up working in places that they didn't go to school for and they're struggling. So he just gets it. I do like him
Yes.
too.
I'd like to have dinner with him. I think he would be one entertaining person
I think so too.
to get to bounce ideas off with.
Marty?
With me, it probably any modern president. And the reason for that, because people don't realize what goes on behind the scenes. They don't understand what goes on while you sleep. And I would really like to dig in the brains of some of those things that, like I said, you be thankful for things that go on while you sleep, that they go on, so
Yeah.
you can sleep peacefully.
If you could bring back one tradition from your childhood, what would it be?
I remember my parents were divorced. On my birthday, my dad, after I get home from school, he would always come and pick me up, and we would go to eat, just the two of us, and he would take me, and we would just kind of spend that little time together. And I really enjoyed that. And my mom, of course, made me a homemade cake. It was never bought. It was always homemade. So I like those two traditions. And I think sometimes I get too busy.
Yeah.
Even though I like those things, I don't know that I always do it for Kayla. I try, but if I could really make a conscious effort, maybe going forward with grandkids, if she marries and has kids, maybe I can make it up that way. But just those special moments. It doesn't have to cost anything, doesn't have to be anything big, but just those quiet moments and those good little memories.
Sounds good. Marty?
Mine would probably be, it's just telling too much, but as a kid growing up, especially in your early teens and stuff, you don't realize some of the importance of grandparents or of a particular grandparent.
Mm-hmm.
And when they're no longer with us, you realized you missed some of those things that they would do, and you realize now they really held the glue. They were the glue.
Mm-hmm.
There's a lot of times that one grandparent or somebody that held that glue together for everybody else. And you go back and you think, yeah, if I could have that piece again, that's probably it for me.
So Marty, if you could sum up in one sentence what having Rachel with you on this journey, what that is meant to be in one sentence.
Peace.
Oh, that was good.
That's one word.
That's one word. Now, Rachel, I have the same question for you, but with Marty. And
I think he's just security. He's just my security. He makes me feel secure. He lets me know that I'm needed and wanted, and that I'm in a safe space. Even if we may not agree on the same thing, he still at least allows me to know that I'm secure, and that's a big that means a lot to me.
That's wonderful. I've really enjoyed interviewing you both, and I want to thank you both for doing this. And I do want to make a comment that when it comes to hiring someone like myself, a board certified patient advocate, first look to see what's out there already. Because when you're able to find an agency like HFC Insurance, you have one, and you really do. You have one. And in that case, you have what you need. And that's really important for people to understand. They're not always out there, but when they are, it's golden within an agency. So, I want to thank you both. Do you have any last comments or
Well,
anything
just
you'd like
tagging
to
on that,
say?
what you say is when you know you got one, know it, keep it, share it, because there's not a lot of them out there.
Yeah.
And it's important. But sometimes people will say, "I didn't know. I just didn't know you were here, or I didn't know this was available." That's the when we pick up a new client or a current client, when they say, "Look, y'all are just invaluable. What you helped me with, I can't tell you enough." That's the most important thing.
Mm-hmm.
That's the most important thing of what we do. When somebody leaves our office, they know they were helped. They know they were cared for, because it's missing.
Yeah, it is missing. Well, it's taken me, I know that we may have spoke a couple of years ago, but then we finally had an opportunity to
Yes.
do a Zoom.
Yep.
And I'm so impressed with you, Rachel, that I'm going to shout it to the rooftops. Or is it shouted on the rooftop or shouted? I don't know, but
you just shout it.
I'm going to shout it.
Shout
I'm
it,
going to
girl.
shout it. So you make a difference when it comes to navigating the complexity of healthcare insurance and healthcare in general.
It is a beast. It's not something to take lightly. And I'm hone in on this last point. For our Medicare clients, that's probably one of the biggest decisions that they will make, close to being one of their final decisions that they will make. But it is so instrumental to let it be the right decision that they make. That people just do not realize how important that final piece of your health care being in place makes all the difference.
Whether financially or sometimes getting the treatment
Yeah.
you need.
Yeah.
It's that important.
Yeah. Thank you for sharing. And
Thank you for having me.
yes, thank you.
Appreciate it.
Thank you.